My name's Leanne Scrogham and I live in Ulverston in sunny Cumbria. I have got a passion for health and social care that has been from very young, from supporting my sister. And on leaving school, I went straight into care for looking after people with learning disabilities and mental health, which was with the NHS, and eventually took over to creative support. I then decided to go into domiciliary care and spent 8 years as a registered manager there, working between 3 different locations. About 4 years ago now, I became the registered manager. I thought I'd try my hand at a care home, so I came into the not-for-profit sector and joined Abbeyfield Lakeland Extra Care, which is Heartland House, and we are a 30-bed residential home, which is not-for-profit. So Nobi, just to introduce you to Nobi, it's an age tech company founded in 2018 in Belgium. They believe that everyone deserves to grow old in a dignified, safe and happy manner. And the star of Nobi, the star of the show, is its AI-powered smart lamp, which watches over the safety of older adults. At its core is fall detection and fall prevention. Nobi Lamps at present is in 21 countries, 6 offices in 5 countries, distributors and resellers in 9 countries. And at the end of 2024, there was more than 50 employees. Excitingly, at the back end of 2024, they have signed up with Frontier, let me just get the name right, Frontier Senior Living. It's one of the largest and most renowned senior care providers in the United States. Following impressive results, they decided to roll out Nobi smart lamps across 56 of its locations. So I think this year is going to be very, very exciting. A bit about us and where we started. We're a 30-bed residential care home offering personalised care for residents. We are set in a village in Milnthorpe. We are about 20 minutes from Lake Windermere. Technology we started using May 2023. And that was a pilot, a 4-month pilot we were asked to take part in. It was funded by the NHS Lancashire and South Cumbria Integrated Care Board. A total of 8 lights were funded as part of the programme. The most difficult choice was deciding where those 8 lights were supposed to go. So a lot of residents, how we manage falls in the health and social care sector. A lot of our residents go into residential care when they start to lose the confidence and the mobility. We get a lot of people that have only had sort of one fall and they lose the confidence straight away, so they think that going into a care home that is going to solve it, but unfortunately it doesn't. Over time, this can change within the care sector. We've all looked and tried different systems that work, and for us the main ones that we tried was acoustic monitoring, mobility aids, physical checks, which we do through the night, in the daytime, nurse call, pendants and pressure mats. For us, Nobi came at a time, to be perfectly honest, at a time when we were really, really frustrated because we had all these things, and particularly the pressure care mats as well. We were at our wits' end, so when we got offered this pilot, we jumped at the opportunity to take it. So the nurse call systems that we've got in place, academic research indicates that in instances where the oldest elderly fall and cannot get up independently, only 20% manage to use the nurse call system for assistance. Tragically, the remaining 80% must wait until they are discovered to receive help. At Heartland House, the statistics align precisely with academic findings. 82% of the elderly residents were unable to use the nurse call when needed, which implied that the current technology we had in place was not adequate and it did not give us swift assistance where it was most crucial. As a result, average response times for falls can be extended up to an hour. Clearly for us, there was an urgent need for immediate and a reliable solution that actually did what we needed it to do. So how does Nobi's AI work? Every second, Nobi scans the room with optical sensors. Nobi's AI recognises objects and people in the room and analyses their position in and out of beds, in and out of the bathroom, on the floor, and so on. So the key Three key areas is fall prevention. We got it. Fall prevention. We've got automatic lighting, night light, fall risk alerts, and falls analysis. Fall detection. It never misses a fall. It alerts caregivers immediately when a resident falls. This allows caregivers to provide assistance very quickly. And this is done through, you can have access to a desktop. So all my office staff have access to the desktop where they log into the system and can see what is going on, and the alerts come through, they can jump straight onto an email. But we also have handsets, mobile phones, where we've got Nobi linked up to, so Nobi will ring that phone, and if a person has had a fall, it would ring the phone and it would tell you which room number the person has had a fall, so you're able to locate it. And then two-way communication opens up, so you can actually speak to the resident to reassure them that you're on the way to get to them. And then from a reporting aspect, I can come in the following day and I can get on and see all the logs and see exactly what's happened. 100% accurate, sees every fall. Smart care, live check-in. One of the big things for us was discussing with CQC what they felt regards having something like Nobi in place. So Nobi gives you actually three different, so you can have it where you have it completely private and it's not switched on. You can have it where your picture is a stick image, or you can have it where it's full so you can see everything, and that's down to the resident what they wanted. All of our residents took to it very, very well. We did have a couple that didn't want to do it. They felt that they were being spied on by the government, one of them actually said. So we kept her privacy settings completely off. On the live check, through the stick image, you can see through, so we've been able to reduce the nighttime checks because we can do that remotely. And when I spoke to CQC about this, they were astounded really, because if a night check is depriving somebody of the liberty, so if you are able to reduce that, it's excellent. So we've done that with a lot of our residents now. Night report, they are amazing. We can see what everybody's getting up to through the night, and it helps sort out medication and things like that. We had an initial rollout phase of 1.5 months. Nobody was in learning mode at Heartland House, and that was awaiting integration with the handheld devices and the nurse station infrastructure. As Nobi has developed, it's become ours because we were the very first home in the UK to actually have these lights. This observation period provided an invaluable snapshot of the situation before Nobi's prevention capabilities were integrated into the community's operational flow. Typically, learning mode results indicate an unreported fall rate between 70 and 80%. However, Heartland House's data paints a slightly more optimistic future. When we extrapolate data to a standard metric of over 100 rooms a year, there were 226 reported falls, yet the actual likely number is closer to 625 falls across all rooms during that time frame. This suggests that care staff might be unaware of 60 to 65% of falls with Nobi, what was once hidden is now illuminated. And particularly in the beginning, we had a massive influx of falls, and it did cause a lot more work. But what we realised, it was quite scary that we'd been missing them all. While the results were noteworthy, they were consistent with outcomes from other Nobi pilot tests. The Nobi prevention programme led to an 84% decrease in falls among the caregivers with Nobi provide help 28. So Heartland House took an extra step in their evaluation by estimating potential intervention times in scenarios where Nobi was not active. They accomplished this by noting when the next likely room check would have occurred for each fall incident. Without Nobi, their analysis concluded that the average intervention time would have been approximately 57 minutes per incident. However, with Nobi in place, Heartland House recorded an astonishingly low average intervention time of under 2 minutes. It's remarkable, even by Nobi's own standards, as the average across their entire installed base stands at 3.7 minutes, still impressively below the 5-minute mark. but we have been described as a Usain Bolt of caregivers. Initially, we decided that we were going to probably spend a minimum of a year and review where we were and what it looked like for us about getting any further lighting within the home. And then one morning I came into work and one of our lovely ladies who wasn't at risk of falling didn't have a Nova light in her room, and she'd actually fallen in the night. She'd wrapped herself up in a duvet, fell out of bed and had a serious head injury. And when we found her, it looked like she'd had a 2 hour long lie, because that was the last time that she actually had a check. That, as a manager, it's a bit of pill to swallow, particularly when you know that you've got something in place in other rooms that could have actually saved that long lie. Fortunately for us, she did get better, but we decided that we weren't taking that chance and that we were going to put Nova light in through the remaining of the rooms, and we did that within 6 months. We'd made that decision. So costing, well, it was in 2022, so none of these figures will be correct, but total cost per room, we were looking at about 2,282, and that was for all the fitting and support, ongoing management and training, etc. for the home. And when we actually worked it out, it was 8p per day. And for that, you get a Nobi smart lamp, and you get the Nobita. So the Nobita is the baby that goes in the bathroom, so that is also covered with your Bluetooth switch, your lifetime licence, which is classed as 7 years, and delivery, installation and setup. Negatives. So we did have some negatives, and I would rather be honest and let people know what the negatives are before they even think about going into something like this. Wi-Fi. It was our biggest bugbear. We thought we had good Wi-Fi, however, we didn't. And when the lights got fitted, the lights weren't working in certain areas because of black spots, and then that resulted in data not getting transferred on time. So there was a big need for us to improve our Wi-Fi. I had to get IT guys out, and it cost us a bit of money, and we had to get all new access points throughout the home. Once we got that, it was working absolutely fine. But to be mindful, you might think you have good Wi-Fi, but actually when it comes down to it, you possibly might not. Frequent power cuts, because we live in sunny Cumbria, we do get quite a lot of those. One thing we weren't prepared for at the beginning was making sure we had backup lights for emergencies. So we have battery operated push lights that we can use in an emergency. Residents, as I touched on before, thought government spying on them, suspicious thoughts, really didn't want anybody seeing any aspect of their life. Interestingly, the main resident that didn't want that actually has it now. She suffered from frequent falls and decided that she wanted to then get the light switched on. So she's actually changed her mind. Influx of falls at the beginning. Cost, that can obviously be a negative for you if it's a big outlay and it's something really, it's huge. You can't just be spending money like that without knowing that it's going to work. But it is the best thing that we've ever done at Heartland. Sorry. Reporting functions, they need to be improved. But they are. I want to be able to see that you can pull them off in an Excel spreadsheet. And that's what apparently is coming. Staff putting creams on, stuffed toys, dressing gowns, they can sometimes be picked up by Nobi as if they are a person, so you can get a false report from that. Some of the feedback that we've had, peace of mind provides to both our staff and families of residents of being invaluable. One family member went as far to say, Nobi has truly made a difference in enhancing the safety of my mum's life, as well as the rest looking after all of the others at Heartland House. Just some stats really, and this is from when we actually did the pilot in 2023. The figures then when doing the pilot, 45% reported falls in care homes resulted in an ambulance call out. with reported falls per year in care homes at 600,000 and the cost of an ambulance call out at 252, it meant the NHS was spending hundreds of thousands of pounds on call outs. If no alarms were rolled out across the 600,000 care home beds of the UK, they could have prevented 1,381 falls per day and saved the NHS £156,500 every single day. That was a couple of years ago, so it's big money that people would be saving. And from the success at Heartland, it was amazing to learn that NHS Lancashire and South Cumberland's Integrated Care Board have committed to furnishing another 500 homes with no biz lights. So that's it. That's nobody.